Every single hospital system right now is looking at ways to expand capacity.
A rep for
For
Legacy Health
instance,
making that
we
point
know
clear
that
via
within Legacy
FaceTime
Health,
today. The interview was a follow-up to a press conference from Oregon's governor, which featured this announcement.
I'm activating a COVID-19 healthcare system response joint task force.
In short, the state called on local hospital groups, OHSU, Providence, Kaiser Permanente, and Legacy Health to merge, forming one big healthcare system aimed at managing a likely spike in coronavirus cases. As part of that, those local hospitals are now in a metaphorical sprint to open up more beds. Right now, health officials said there are approximately 6,000 licensed hospital beds in Oregon.
The state of Oregon may need an additional 1,000 hospital beds and 400 ICU beds to accommodate the volume of patients by April 11th, based upon our forecast.
So in response, reporters asked, how big of a feat is that? And the short answer appears to be pretty big. So let's start with where Oregon stands with the hospital beds we do have. And for that, we turn to the Kaiser Family Foundation. It's a nonprofit that researches the healthcare industry, and that includes keeping track of the number of hospital beds per state per capita. This page, first dug up by OPB, is already on my social media feeds if you want to see it for yourself. At last check, in 2018, it ranked Oregon dead last and Washington second to last for the number of hospital beds per 1,000 residents. Oregon, the group reports, has 1.6 beds for every 1,000 people here. Washington has 1.7 beds. The national average is 2.4. South Dakota has the most, with 4.8. Officials yesterday said amid normal times, Oregon's low bed total is actually a good sign. It means the system is sort of intervening early and keeping people out of the hospital. But amid a pandemic, it's a frightening, if not deadly problem. So now officials are searching for space to stick more beds. Some states are using tents. Former Oregon Governor John Kitzhaber reportedly wants Oregon to consider the long-empty Wapato jail in North Portland. Yesterday, officials said they're not ruling anything out. And today, Brian Terrett told me there are options already out there.
We know that within Legacy Health, every single one of our buildings actually has extra capacity under its current license that it doesn't typically utilize. So we have rooms and beds that are typically empty because on a day-to-day basis, we don't necessarily have the kind of volume that we need to have to fill those beds.
In other words, there is hope, but a lot needs to be done, more so here than in other states. Plus, he noted even if there are enough beds, hospitals also need to worry about keeping staff healthy. And to do that, they need to stock up on medical supplies like gloves, gowns, and masks, which officials note are already running low. Governor Brown said yesterday she's asked the feds for $7 to $10 million a month to help make all that happen. Reporting from anywhere but the newsroom, Maggie Vespa, KGW News.